Hi everyone, it's Dr. Zach Boris from Dickinson County Board of Health and Lakes Regional Healthcare in Spirit Lake, Iowa. I'm going to take my mask off because we are more than 6 feet apart, but it is May 22nd, the day before Memorial Day weekend. Happy Memorial Day for all of those of you who have lost loved ones in the military. Thank you, and we are thinking of all of your families and your loved ones who we've lost, so thank you for your service and your sacrifice. Just want to give a hopefully briefer update today on the coronavirus here in Iowa, here in Spirit Lake, and some of the things that we are pushing as we move into the official summer season here in Okoboji area. In terms of where we are, COVID is still here. Overall numbers are dropping across the country in terms of active cases. That said, in places like Iowa and South Dakota, numbers are still rising. And that includes hospitalizations and deaths, unfortunately. In the US, it's killed 95,000 people, at least, as of today. That is about double the, we're thinking about Memorial Day. That is double the loss of the Vietnam War, and that is in 3 months. So just think about that. This is real. This is having a major impact on our lives, as well as on our families and our society. So hopefully, at some point when this is long in the past, we also are able to honor the folks who we've lost to this as well. I think we can all come together to say that this is still a tragedy, and that we're going to continue to do our best to make it less impactful. There's 16,000 cases in Iowa total. Most of those have recovered, thankfully, but we continue to have new cases daily. There have been over 400 deaths, and that continues to rise. So just wanted to talk a little bit about what we're doing here. So we continue to have universal masking in our hospital. All healthcare workers are wearing face shields and or goggles when they're interacting with patients. We continue to have our respiratory clinic or our potential COVID clinic up and running, and that's going to be for the foreseeable future. So if you have symptoms like shortness of breath, cough that's new in the last couple weeks, fevers, please call, and we will get you in, we will get you evaluated, and if you meet criteria for testing, you'll get tested. Those criteria for testing are getting more or less restrictive as we go forward. So we'll talk a little bit about that. So again, the number for the respiratory clinic is 712-336-6696, and just call. You'll talk to a nurse, you'll get evaluated and decide if you need to be seen. If you are severely ill, if you're gasping for breath, if you're turning blue, go to the ER just like you would otherwise, okay? So we continue to adjust what we're doing on a daily basis. So the big thing that's changing is on June 1st, the Spirit Lake Medical Center providers will be back up in the temporary space on the second floor of the hospital. There will be signage, there will be news releases, but that has been decided because unfortunately our construction is behind schedule, and probably not going to open downstairs until August or September rather than July. So if you see me or one of my partners at Spirit Lake Medical Center, we'll be asking you to go to door L on the east side of the hospital at the new area, and you'll be directed how to get up and down safely from the Spirit Lake Medical Center clinic. Additionally, the hospital is open for elective procedures. It has been for 2 weeks. We've been gradually evaluating how we're doing them and which cases we're doing. We're still trying to limit those that utilize heavy personal protective equipment. So we're not yet doing total joints. We may in the coming weeks. Just stay tuned, and there will be more news on that, but it has been fairly seamless. We continue to have a good supply of personal protective equipment, thankfully, as we've built that up, and we're happy to be taking care of folks and more folks because we feel that we have the safety in place to do so. So I wanted to talk a little bit about just where we are in this. We've been doing this self-quarantine, this social distancing for a good, really almost 2 full months, actually 2.5. And we're seeing a lot of folks who are getting tired of this. There's a lot of quarantine fatigue. There's a lot of just wanting to go back to normal. And I get that. I mean, we're having that at my house as well. You know, the kids are overall great with it, but you know, they want to go see their friends. They want to be wearing masks. They don't want to be wearing masks anymore. And so we're seeing it around the community. We're seeing it around the country. This is longer than we thought this might be, and I think it's going to be significantly longer that we're having to deal with this, perhaps even another year or two. You know, that's assuming that we can get a good vaccine and that we can get it produced. It's going to be a while. So we know that people are making decisions, especially as the economy opens up, especially as restaurants and bars are open. Everybody has to make their own decisions about what they are comfortable with in terms of getting out and being safe. I would still very much encourage everyone to wear a mask when you're out. Again, that is to protect people from you if you are asymptomatic and to give you a little bit of protection from them, but it is not a mark that you have coronavirus. It is not showing people that you are sick. It's really a sign of love of your community to really take care of each other. You can get all sorts of masks online with funny sayings on them, funny slogans, pictures, etc. Just do it, please. That's how we will keep this at bay and not have it decimate our community. We're still asking folks who are coming in for visits to do your part and try to socially distance if you can. Wear a mask if you're going out and you have chosen to do so. And still, if you are in a high-risk group, so over 65, having diabetes, having lung disease or heart disease or kidney disease, please still stay home. Please be as rigid as you have been, because you could certainly get significantly ill from this. So can young people as well, though. So it's all about assessing your own level of risk. Talk to your doctor, talk to your family. Try to keep your social circle as small as possible, and try to, if you are deciding that it's okay to go out and you know, have drinks with a friend, with a group of friends around a fire pit, still try to keep some distance, and if you're talking, put a mask on. You're also seeing that the CDC came out this week saying that there may be less risk from surfaces than we originally thought. So, you know, we've said throughout that the vast majority of this is spread through direct, close contact between people, coughing, sneezing, breathing heavily, and those droplets being transmitted. But thankfully, we have gotten better guidance lately as we've actually done the studies going forward that there's probably less risk than we originally thought from touching a surface that somebody might have coughed on 6 hours ago. The big key to this is still wash your hands a lot, you know, still use sanitizer, but thankfully we probably don't need to be wasting those really expensive and really hard to come by Clorox wipes on wiping down every piece of food that comes in from the grocery store. Don't put it on direct food, but on the packages. So that's a bit of good news, really. I mean, this is less infectious than we thought from that route of infection. This does not mean that it was some conspiracy to keep people scared. It's that we are learning more, and thankfully that is less of a common route than we originally thought. You're also seeing folks who are having, as we have had more numbers, as happens in big outbreaks and big illnesses, we're seeing some of the later effects and some of the more rare effects, because the numbers are just so big that we're actually seeing these rare things in appropriate numbers. So what I'm thinking of is this multi-system inflammatory syndrome among kids. So I just want you to be calmed a little bit that this is very rare, but if children potentially had it a few months ago, whether it was a cough or were exposed, or maybe even had no symptoms, but now are coming down with a severe rash, swelling in their lips, shortness of breath, other symptoms, they need to be seen and they will get tested, because that can certainly cause some significant major health issues for kids. That said, it's probably about 200, 300 cases nationwide that have truly been identified. So this is very rare if we're at 500,000 cases nationwide of confirmed illness. So actually, no, we're at about 1.5 million, I apologize, but still low numbers. So the rash that your kid had last week, probably not going to be this, but if they're acting strangely, if they're having trouble breathing, if they're not as active, get them seen. In terms of testing, we are still doing our own tests through Avera and through the Department of Health here, and that still is for folks who are at high risk or who have been exposed or who have symptoms. That said, the Test Iowa program came out yesterday that they will test anyone who wants it. So this is new. We're not sure what this is going to mean, but if you are if you're curious and you have only minor symptoms or you know you've been exposed, you can go to the testiowa.com site and put in all your information, show that you have or have not been exposed, tell them what you do and don't do for work. And if you want to be tested, you can. Right now we don't have a local site. The closest is going to be in Sioux Center next week, but there is one active in Storm Lake. That said, we still are encouraging you not to go far afield if possible. But if you are really, really wanting to get tested and don't necessarily meet the testing criteria that are the standard testing criteria of having symptoms and having risk, then you can go to the testiowa.com website and they will walk you through the steps of how and where to get tested. So it's just another step in the attempt to get more and more people tested so that we have better numbers. But know that if you haven't had symptoms, it's likely that it's going to be negative, or if you had symptoms weeks ago and are now fine, it's probably going to be negative as well. Antibody testing will be available starting hopefully in the next week or two here in Spirit Lake, as well as at other Avera sites locally. You'll see more about that. It is likely going to be a pay out-of-pocket test, but you will not necessarily need a physician order to do it. So you'll be able to come to the lab at the hospital after calling and setting up an appointment and get that testing. This antibody testing is the validated IgG testing, so it's better than many of the tests out there. That said, we don't know how to interpret it, so it'll test you whether you have had it, and it's a pretty good test. And if you have these antibodies to coronavirus, then it means that you had it at some point, whether you've had symptoms or not. That said, we don't know if that confers long-term immunity to you. So we really don't know yet. So the clinical information from that is limited in all reality. But if you are someone who is convinced you had it and you either weren't able to be tested or because of really tight guidelines at that point, or you tested negative and just you or your doctors didn't believe it, that could be a useful thing for you to do. So you'll see more about that in the coming days. So I promise to be slightly briefer today, and I've tried, but I think I've gone on too long. I hope everyone has a restful, safe, and enjoyable Memorial Day weekend. Continue to be safe, continue to stay with your local family groups as much as possible. If you are getting out there, be reasonable, be safe, take care of each other, wear a mask, and we'll still get through this. Thanks for your time. I hope you all have a great weekend, and I'll speak to you soon. Thanks.